When I first came into government, I began as an information professional. And technically I was known as a librarian, but I was actually an information professional. And I worked at the National Library of Medicine, and we had some of the first online systems in the world. And we had, what we would do is index the medical literature for doctors to make it accessible to them throughout the world. That's how I got very well grounded in information and the power of information to effect change. And so as I moved on in my career and I got a master's of business administration and went into finance. And I first worked at the Internal Revenue Service putting up a financial system, and then later at the U.S. Department of Agriculture putting up a financial system and running the financial operations there.
I went to EPA for 13, 14 years and thoroughly enjoyed my career there, both budget, finance, IT, facilities management. Went to GSA for about 4 years, and then I went to Customs as their first CFO, and then I went to Forest Service as their first CFO.
From a personal experience level, having been mayor of Syracuse, New York, now, Tip O'Neill once said, "All government is local," and indeed it is. I may have spent, out of the last 9 years, 8 years with the federal government as the Deputy Secretary, first the Assistant Secretary for Community Planning and Development, and then the Deputy Secretary at the Department of Housing and Urban Development. The reason I was chosen by the Bush administration to be the Assistant Secretary for Community Planning and Development is because that's what mayors do. That's what county executives do. That's what governors do. It all starts at the federal level, but it all pushes down. All of this stimulus money that's been expended, all of the programs that are put in place, they're put in place for people, as they should be.
I was very pleased to have the chance to come and serve as the Secretary of the VA. My background is really clinical medicine, and getting the opportunity to run some larger and larger operations in the military health system. It's been about 38 and a half years in the military health system,
I moved into a CDC-wide position as I was Associate Director for Informatics for the CDC. We stood up an emergency operations center. The CDC had never had one before. We stood it up with computers and technology and supported to the best of our abilities what was a totally game-changing endeavor for public health. The Office of the National Coordinator for Health Information Technology, where I became the Director for Interoperability and Standards and was responsible for standards, certification process, and the Nationwide Health Information Network initiatives.
We knew within EPA, and I certainly knew as a CIO, that with the internet growing, we just had volumes and volumes and volumes of information. Just multiplying the numbers of it. So we've got a lot more data available online. We have a lot more information online. But yet, how do we better manage and organize it? But yet, people are still complaining that you can't find anything. And that's part of it, is because everything is just by the nature of what was growing with technology and information management.
I am very passionate about federal service. I spent 30 years in the federal government working at various agencies to improve things and to make sure that we accomplished our mission well. And as I look around now, I think with information, financial information, and the Open Government Directive and what we want to do, we're probably at the halfway point. We've taken care of the finances. I think we have good financial information. Now we have to move on to the program information, starting to look at the legacy systems that contain that, how we can extract from them what we need, bring it into a usable form, and then start really looking at, are we operating efficiently and effectively?
The fun part of being a CFO is being involved in the major policy decisions of the agency. And there is a fiscal impact on everything that an agency is doing. And to the extent that you can provide that information in a format, in a way, and it could be, it's not just reporting information, it's not dashboards. It's your advice and your counsel on the fiscal impact of a particular program. And you have the experts to do that and the understanding of both the program and the financial aspects. that's when it becomes really fun. That is the type of thing I love to work on. That is the type of thing that really makes a CFO's day fun.
I have a passion for government. I've been involved in government for a significant number of years. I was a public high school Spanish teacher, a public high school guidance counselor. I was city auditor for the city of Syracuse for 19 years. I was mayor for 7.5 and 7.5 years in the federal government. Now I teach a class at Georgetown University. I guess I don't know any better, but I love public service. I love dealing with people. I like solving problems.
It is much more than a short journey. It's been a long journey. And it's been a journey that in some ways has bubbled up from the base to allow an electronic record that people are comfortable with and that can then start to do some of the things we were talking about. Apply metrics, apply decision support, which is important. I mean, you've got people, busy people, that really want to do the right thing. And what we ought to have is systems that enable them to do the right thing and that support their intent to do the right thing.
You can have the best of intentions and you think it's going to come out this way, and you have to be flexible because some of the great opportunities are in doing things differently on the basis of the technology. And I think that's what medical informatics is all about for me, trying to work through some of those issues and get to the real outcomes, whether they be public health or clinical care. That's why I went into this.
Why collaborate on things, and why solicit information, why engage in public dialogues? And to me the answer is simple. To me it was about, yes, those are fantastic science resources, but there's a lot of other ideas out there to be tapped. And so it just makes sense. Why not find a way to go out there and find new ideas or things we hadn't been thinking about? There's just so much information out there.
I realized, and I took with me my early training about the value of good, solid information, good quality information, and what it takes to get there. That is a perfect starting point for moving on to looking at the programs and doing good analysis of the programs to find out where and how we should be spending our money. So starting there, you figure, okay, we have the financial information. What can we do with it other than produce financial reports? Well, you can extract the financial information, and you can then extract data from systems that have information about the programs and also financial information, pull it into places where you can combine it, and then use the very powerful technology tools we have today to create information from that.
I think a lot of what drives agency programs is their budget, and the whole budget process is all around, what does it cost? What am I proposing? How do I relate that policy to the cost that I'm going to propose? What am I going to accomplish? How does that relate back to what I'm proposing in cost? Usually if it's grounded in good data and good facts, then you have a better opportunity to sell that. And so I always thought as a CFO, that was my job. I was to facilitate a process to ensure that they had the right financial information with the right program information to make good judgments about policy decisions on that budget.
We cannot conduct business as usual. The resources are not going to be there. The money isn't there to do things as they've been done in the past. How can they deliver a product more effectively? That is the third rail, if you will, of what government. They're not only looking to reduce expenditures and raise revenue, but they're looking at ways in which they can do business differently to save money and to maybe have extra money.
I think that we'll go through these cycles of advancement and adjustment, and what's going to be imperative is that we harvest the benefits for our patients, first, for the resources that we spend on healthcare. Second, for smoothing out the business processes to make access more ubiquitous, because I think this has the opportunity to do that too.
When an industry is becoming electronic, and we're now at the stage of clinical care becoming electronic, you have to get more specific than people are generally comfortable if you really want to make that process work in the technology. Think about what you can do with that and the promise of being able to analyze disease trends, being able to analyze treatment modalities with much greater specificity than is done now, being able to mine the practice of health, for the lessons about how we should be treating patients.
I'm a very big proponent of sort of engagement, collaboration, making data available for all the right reasons. But one of the things I think that we need to do is make sure that as we're looking at open government, that we're actually making sure that we're doing the right things. We're actually looking at the kind of information that we're getting, not just from a content perspective that informs the decision, but also from a process perspective for open government. What I actually want to measure to figure out, am I getting the value out of this? And then how does that actually inform and improve my business or my mission? And really that's what it's about.